Hi, I'm Marinel Kniseley, and I've been working as a researcher with Dr. Cindy Jardine in the Health Sciences Department, exploring the impacts of COVID-19 on temporary foreign agricultural workers, or TFWs, and their employers. One of the dimensions we're looking at is the perspective of TFWs on COVID vaccines and their interactions with healthcare providers during a time of the pandemic. When COVID hit, some of the first people allowed to enter into Canada in 2020 were TFWs, and those coming to BC went straight into a quarantine program that was totally unique to this province. Because of the personnel needed to usher, monitor, test, and vaccinate this group, the quarantine program became a gathering point where multilingual healthcare workers were brought together to attend to the thousands of TFWs entering our country who don't usually get that kind of care. Some preliminary findings are that workers from urban centers had a lot more awareness about COVID-19 and vaccination than from rural areas. Most workers were receptive to the vaccine, while others felt sufficiently protected by their own faith and or their health beliefs, and still others worried about repercussions on fertility. However, the biggest fear shared by all was that of testing positive, missing work, and getting sent home, which would be totally devastating for their families. All of this led to a deep hesitancy to disclose symptoms, and this is where COVID resembles any other disease or health condition experienced by these workers while they're in Canada. This was managed on site, though, by the ability to communicate quickly and privately with staff that understood them. So to sum up, the quarantine program became this unique microcosm that displayed how valuable and effective it is to provide healthcare for workers in their language that's culturally informed, that's accessible, and that's sensitive to their very vulnerable employment situation. That's it.